just trying to get you to struggle.
I already have it.
Okay. Yeah, you got it. Okay, so that's great. So let's go over it. Let's go over the appliances then. Okay, just so you have the right answers. Okay. All right. So for space maintainer, we've already established that it's C. Okay. So hold space when primary teeth are lost early. Okay. Space maintainer. For a space maintainer.
Oh yeah.
In the book, for a space maintainer, it says to preserve space following the loss of a tooth.
Yeah.
And then space regainer says to regain space from early loss of primary teeth.
Yes. So okay. So read space maintainer again.
So to preserve space following the loss of a tooth.
Yes. So
That'd be L.
if a primary tooth is lost early, we'll put a space maintainer in.
To maintain the space.
To maintain the space. So following the loss of a tooth, because it fell out early. Let's see, for some reason I can't find where, what page are you on? Yeah, to preserve space maintainer, to preserve space following the loss of a tooth.
They've over-erupted, but I wonder if they just lost it.
Does that make any sense? No, it's not making any sense to you? Okay, so let's see,
I think this is L. Space regainer and space maintainer. Like there's, like one talks about the primary teeth.
yeah?
And the C talks about the primary teeth. Whereas the other one just mentions the loss of teeth.
To regain space from early loss of primary teeth. So what you could do, what could happen is say you lose your primary tooth early, they don't want things to move anymore while the space regainer is being made, so they'll put a space maintainer in. When the space regainer is made, they'll put the space regainer in.
Oh.
So they might use them together.
Oh, okay.
So that's the only thing is things move quickly. So say a primary tooth falls out, right?
Okay.
Yeah, you don't want it to move anymore, so you take 2 impressions probably. So you'll put a space maintainer in. So you could probably do that the same day. And then the space regainer. Yeah, that's the only thing I can think of to help make that make any sense. But the purpose of a space maintainer is just to preserve the space, okay? Maintain the space. And then what do we have on this? So for
D.
uses springs to regain lost space. So I know it's a little bit confusing, but does that help at all? Space maintainer is not actually doing anything. Space maintainer is passive. And space maintainer is doing nothing, it's just holding the space. Whereas a space regainer is active. So I think that's the most important difference. It's just that the space regainer isn't actually an active appliance. Right?
Actively regaining.
Exactly. Yeah, it's moving teeth. Yeah. Whereas the space maintainer is just sitting there. Making sure that nothing else changes. Does that help? Make that a little bit more clear? Yeah. I think that's the most important difference between those 2 things. Okay. All right. So moving on. What did you guys get for RME? D. Yep. So D is maxillary skeletal expansion. Okay. You can circle skeletal. Super important. Skeletal expansion. Okay. And for Holly? E, yeah, so removable retainer with a wire anterior bow, okay? We could also call that a labial bow because it's right by your lips, okay? And let's see, quad helix. Yes, so for maxillary dental expansion, and you can circle dental if you like, just to make it super clear, okay? So the quad helix, and how about for an Essex?
H.
Yeah, so a clear light plastic retainer. Okay, you'll probably see those quite often, Essex retainers. How about a crib appliance?
K.
Yeah, so a habit appliance, stopping the thumb sucking habit. Okay, and spring retainer. Anybody get the spring retainer?
I did K.
Yeah, so it is K. It's a removable retainer used for minor tooth movement. So here I have a full tray full of these cool looking things here. So it looks like a Holly retainer, which, I mean, it technically kind of is a Holly retainer, but the thing is it's adjustable. So here's a good example. And you can adjust this, right? Or this one here. You can adjust this, okay, moving things. Okay, so this looks like a lower. So you can adjust these labial bows here. Okay. And then also this would probably be just for one tooth.
So that would be active?
Yeah. So these would be good examples here. So this one looks like it's for the lower. Yeah.
I remember the beginning here. We would know
And
when
then
that
here's
was.
one probably just for.
Oh, yeah.
Like September.
Yeah.
And you can adjust those little wires.
And what's that? What's that?
That's just, yeah, multicolored, yeah. Probably for the lower interior.
It's like every day we're getting things.
Like we're going out every single day.
This is a spring retainer. So this is an active
Is that what I mean?
appliance. This is moving teeth.
Oh,
Yep.
yeah.
So here's the spring retainers. Okay, a tray full of spring retainers.
So they're always removable, they're
Yeah.
never fixed.
Yeah, these ones are removable. So
Or is
these-
there some-
these type?
So they'll never be fixed.
No, yeah, not for a spring retainer. Be removable.
I have something like that.
Oh yeah?
It doesn't have
Oh yeah, that happens if you don't wear these. So here's a lower one. Moving the anteriors. Okay, so you can adjust these. Can't tell if it's supposed to be like that. Anyway, you can adjust these labial bows so they can be bent.
Oh, that's the bows.
Yeah, so this is the labial bow. So that's what a labial bow is.
Second to think about it.
And it's a hollow.
It's a spring retainer. So it's called a spring retainer. It looks like a holly. Yeah, but it's actually functional. So a holly appliance is passive.
Oh, okay.
Yeah. So this is the labial bow, in case you guys are wondering what that looks like. Labial bow.
No.
Yeah, so it just goes over your arm.
I don't know what
Yeah.
I don't know which one. My teeth strong.
Does that kind of make sense, so you can see it?
Yes.
Yeah.
Thank you. I like these sheets when you go along with it.
Yeah, they are helpful. Okay, but yeah, feel free to check out the appliances before you guys go. We still have a few more things to do here. Okay, so continuing on, spring retainer, I got distracted. How about bionator?
J.
I skipped it.
B, bionator B, functional appliance, okay? Remember that big mouthful?
Which can also be a twin block.
Yes, yeah, but that's a totally different appliance, but yes, a functional appliance is also a twin block, exactly, yeah. So that's good, because you'll see the twin blocks for sure. You might see a bionator, but I think they're kind of like old, anyway.
The bionator?
Yeah, yeah. So, yeah, we used a lot of twin blocks. How about the edgewise system? F, fixed brackets used for comprehensive treatment, okay? And space regainer. L, uses springs to regain lost space, okay? So that's your space regainer. And what'd you get for functional appliances?
J.
J, so yeah, change the skeletal appearance while controlling the musculature.
Did you have a question about that though? We didn't
Yes.
ask earlier, just
Yeah.
to clarify. What was what is the two piece? Was that that makes the jaw, what was that called again?
Twin block.
The twin block.
Yes.
So is that just for the lower jaw or?
Yeah, so class 2 correction.
Class 2 correction.
class 2
Specifically is all it's
Yes.
doing.
Functional is all,
Yeah.
is only the jaw movement.
Functional is muscle related.
So it could be different things, but
Yeah.
the twin block is specifically for.
Specifically for class 2.
Okay.
Yeah. Yeah, twin block will correct class 2. It'll train your lower jaw to come forward.
Thank you.
Same with the bionator, but it's just, they seem mean, just like this big giant, like here for this hockey puck in your mouth. It just seems like a lot, like to go in there. Anyway. Okay, and for speed brackets. G, yeah, brackets using doors as ligatures. Okay. So that's that one, and now you have the right answer for my question. Another question? Good. Good on that one? Okay. That's great. And Hayden. Are you kidding me? Yeah, we talked a little bit about Invisalign last class. Do you guys have any questions about Invisalign? Pretty much went over like the evolution of it. So head here can also be, or can be used for exterior. So there's intraoral and extraoral blank. Do you remember? Recall. Intraoral blank.
Anchorage.
Anchorage!
Oh.
Yay!
Oh, that's awesome.
That's great. Oh my god. Nice work. That's great. Recall. Perfect. So just a few different kinds of braces, right? Different examples. So you got your self-ligating, and you've got your lingual, which is really interesting. Look at the accommodating wire for the premolars there. It's really interesting. I haven't really seen those in real life. Got metal, ceramic. So the clear braces are actually made of ceramic. So if you ever get clear braces, they're gonna break when we take them off. Okay. Because of the material that they're made of, they're actually designed to break. And then we've got the clear aligners, so like Invisalign, self-ligating and traditional brackets. So just different kinds of braces. That's that. And there's this cute little I like that one.
The tooth has a butt too.
I don't know, it's his furcation. Don't look at his furcation. And then I know you guys love all these quizzes and stuff. It's awesome.
I honestly do.
It's good for studying.
Yeah.
Oh yeah, no, we're just doing it because you know what, it's really important for your studying stuff, okay? And was everybody here yesterday when I told you about you know what you should focus on for the exam? Yeah. Yeah, I'll go over it one more time. I'm not giving you specific answers or anything, but you know just what you should study.
You don't want, we can do that.
I know, right? I know you really love that. No. So I have. Oh, you did? So I don't know if you guys want to jot this down if you haven't already, but just to make sure that you study the indications and contraindications for orthodontic treatment. Okay, so indications and contraindications for orthodontic treatment. Treatment categories, okay? Habits, appliance categories, okay? And then of course, classifications and profiles associated with the classifications, okay? So those are the most important things for you to just know because it's gonna come up in your jobs too. It's gonna come up in your work, right? You're going to be seeing class 2, class 3, you know, class 2, div 1, div 2, and it's important for you to recognize those things, okay? So let's work on this quiz for a bit. We'll just do like a couple minutes of quiet time and then we can talk about it, okay? Sound good? And this is just for later, so this, I'm just gonna hand this out right now. This is for next class, okay? So I'm just gonna say that this is due next class, which is the 29th, okay? So there's a worksheet, so you can save that for later if you want. But yeah, just do the quiz right now. Yeah, just, ask me after class and I'll grab, whatever you need there, so it's for next time. Okay, so we'll just do a couple minutes of quiet time. This is, it's another ortho module handout, but this one's for next time. That's section 5. And there's a little worksheet that goes with it. So we'll just do a couple minutes of quiet. For some people need quiet.
each other that, and I was like,
Oh,
Essex,
that's-
what is Essex? But like they're talking about that, right? So it's funny.
Can you get bracelets? And then you get a retainer. after you
Yeah.
get bracelet off.
But nobody wears.
So then yeah, so you have like in my head that's usually, and then you have, I got that one after.
So the white choice white, you just pop it in, you're supposed to wear it, I think, or whatever. Oh, okay, that's.
Yeah, but-
But like having, no. So that's my mom has one, she's gonna be.
Yeah.
I should couldn't figure out what.
Mm-hmm. Yeah. On your dentist? Cool. See, you have more Oh my god, that'd be the day. That would be the time.
It's a nice to get the buttons
Yeah.
off. And the polishing up. Yeah.
So I brought cookies.
Oh,
I
they're
brought
so good.
ginger molasses, chocolate chip, and lemon. Cookies, they're little tiny cookies, little gluten-free.
Is it shut?
They're delicious, yeah. Yeah, they're wheat and gluten-free, and they're actually delicious. We already opened them. So have a napkin.
Thank you.
Gracias.
And what kind of cookie?
I'm so confused though. No, don't say that. She's the tissue.
We'll eat a cookie and then we'll chat about it.
Okay.
Sound good?
No, don't listen to Hayden. Hayden's
Oh.
on that one.
They wrote that wrong.
Okay, what can I help you?
Essex. I'm like, it's not sinking in my head, so.
Essex, yeah, so it's a clear retainer.
Okay.
It's a brand name.
Yeah, it's a brand, it's a clear retainer.
Clear retainer.
Clear retainer is Essex. Essex is clear retainer.
So it's not clean ass, don't tell me that.
No, it is.
It's a brilliant last name.
He said tissue.
What sounds good?
She knows she is a great,
Nobody wanted those. I know.
And this
Oh,
is
I
bigger one. Essex is a brand name, so it's like the movie Essex. That's right. Like the clear retainer.
That's kind of nice.
Yeah. But I still make sure clear retainer.
Yeah, there's chocolate chip, ginger, or.
Maybe I said tissue.
Sorry. Ah, disturbed your cookie. What kind would you like?
Surprise.
Surprise you. Do you want to try another one? Sure. Just because I already have a bag open. Now you might have to catch it. What kind would you like?
Lemon, please.
Yeah. Oh, that's awesome. You guys love these ones. eh?
With lemon pie.
Perfect. Yeah, they were.
hoping for lemon or ginger.
Yeah. There might be enough for you to have another one. You know.
Whoa, these are like really lovely.
They're really good, right?
Oh my god, they should sell these for the bake sale.
I got them at Thrifties.
I
Thrifties.
wanna try.
Napkin.
It's actually really good. Shocking.
Ginger, lemon, and chocolate chip.
We're gonna have a ginger and lemon and share.
Oh, that's a good idea. Okay, so
No, not really. No, not really. You're gonna try it, like, they actually taste like
they were quite good.
They like soft. Just get it like napkin soft.
We have
Oh,
some.
that'd be good.
So, no,
Thanks for showing up, you guys. I really appreciate like just you guys being super supportive and all that. I really do. I know it's.
Sorry I couldn't stay yesterday.
Oh no, like life happens. You gotta do your life, right? Okay, so what kind would you like? Lemon, ginger, chocolate chip. It's too many choices. You want a lemon one? No. Hey.
Whichever one has lots left in the bag.
Well, they all have quite a bit. Yeah.
It's better than that one.
Yeah, you're right.
That's what I do, like my decision.
Yeah, they all have quite a bit. What kind would you like? Lemon and chocolate chip? Lemon? That's so awesome. You guys like the lemon one? Okay. That's great. What's that? I haven't tried the lemon ones yet. Yeah, I tried the chocolate chip and the lemon.
Oh.
They're really good. Does anybody want another cookie?
Lemon.
You like those ones, hey? That's awesome. The last class missed out then. Because we didn't even open the lemon one.
Really?
And what kind would you like? Chocolate chip.
Yeah.
Yeah, I was thinking like everyone was gonna love the chocolate chip ones because that was what went last time was the chocolate chip.
Thank you.
The lemon was like, do we all get lemon?
Yeah, actually a lot of you guys chose lemon. That's awesome. What kind would you like?
Chocolate chip.
3, 4, 5. And like hopefully good for your immune system. What kind would you like?
I'll try chocolate chip.
Yeah, they're really good. They're like juice. Eat it, don't look. And eat one. And now make sure you floss and brush.
Yeah, right.
Retentive snack.
Anything else you can say right now?
I'm not gonna lie, every single day I pack apples and carrots just because I'm like, oh, I'll eat something and then it's like, detergent food. Okay, should we go over our quiz? Are you guys still working on it?
Please.
Okay. Yeah, those are delicious. They're way better than I thought they were gonna be. I was like, gluten free.
It's nice because they're not really sweet.
Oh yeah, that makes sense.
I wonder if Brianna will do us cookies too. I think the pop quiz, our first, like, she's teaching today, she's doing the pop quiz. She walks right in, doesn't it?
Well, I mean, we all know about it.
No, I just think it's, well, yeah, but I think it's funny. Well, I know she has cookies for us too.
Oh, she's probably being forced to do the quiz, right? Not forced.
Yeah.
Oh no, it's just funny. Oh yeah, no, totally, it's just funny. So she's like, boom, pass away.
Yeah, I didn't do the reading.
Jump right in. It's kind of interesting,
Just read
actually.
it, it's really short.
Yeah. It
Just
was.
some slides.
What's Nina 141? What is that one about?
It's preventative.
Special
Sealants,
needs, right?
anti-periodontics, for special
Okay.
needs,
Very interesting.
Pro-V.
I'm sure we'll see that.
We're doing special needs unit today.
Super important. You guys are gonna see that. Okay, let's go over this thing here.
Really cold.
How about let's talk about everything that we did today. Any like questions or anything to start? No? So what kind of stuff did we discuss? Retainers,
Fixed appliances.
fixed appliances, yeah.
I got this.
Passive, active.
Passive, active.
People have like expanders and appliances with braces as well.
Sometimes, yeah, so what we'll do the expansion first, and then the braces, and the expander is just holding everything.
Gotcha.
Yeah, so we'll actually put a bit of like a blob of glue in the keyhole,
Oh.
so that nobody sneaks a turn in. No, it's just so that it doesn't turn back. We always joke about that though. Okay, so passive, active, functional, right? Functional, examples of functional appliances?
Oh,
Spinator.
Spinator,
Stop.
Twin block.
twin block,
Army.
good. R&E functional as an active,
No, I have that.
right? Active.
got that wrong.
Yeah.
That's
Okay.
functional as well.
It's an
That's great.
active.
And we did fixed appliances.
I see like a functional
No, it's an active appliance. So functional is muscle related.
Muscle related.
Muscle related, exactly.
Functional?
Exactly.
Functional muscles.
Yeah, army is skeletal expansion,
Yeah.
but functional appliance is muscle related. So we're getting confused between those things. Yeah, I know, there's so many terms.
No, I got it.
It'll just take some reading through and it'll come.
So skeletal is active.
Yeah.
Okay.
Yeah, exactly. So that's your RME, right? So we've got active fixed appliance, that's RME. What else? What would what kind of appliance is a quad helix appliance? Active. Yeah, exactly. How about what about Invisalign? What would Invisalign be?
Active.
Active, yeah, exactly. Okay, so I'm actually gonna go over the quiz now. I know I'm like just going over, I just wanna make sure we've covered everything and sort of summarize everything, okay? So, I know you haven't had a chance to actually write the quiz, but if you wanna write down the right answers, then that's probably good for studying. Okay, so number one, what'd you guys get for number one? C, okay, the appliance that works with facial musculature, involves maxillary and mandibular arches, is a functional appliance. Which is also a, let's say it again, spinator and a twin block. Yeah, exactly, things like that. I feel like the more you go over it, it might sink in, yeah. Okay, and okay, so number two,
I have
Why no is active though, wouldn't it be
functional.
Oh, so what?
Yeah, it's functional.
Okay.
Yeah.
I got it.
Yeah.
Okay.
Yeah, it's functional. Okay, so loose bands and brackets need to be attended to immediately. Why?
to relapse.
Yes, exactly. So to prevent undesirable tooth movement, to prevent teeth from moving in a way that you don't want them to. So that's one of my points. To prevent undesirable tooth movement. Okay? And then I have a little description brackets and bands mean that the teeth are without wires to guide them into place, okay? Thus creating the opportunity for unwanted tooth movement. So that's one huge reason, is because then they're not engaged in the wire, right? And what's another reason could be?
The normalization process.
Yeah, that's kind of the undesirable tooth movement part.
Yeah.
I would say that kind of all belongs in there. But how about like a loose band is coming up and
Oh, it's pokey.
it's irritating, but that's I'm looking for something else. Coming up and getting like all dirty and then
I was thinking like damage to the tissues.
yeah, damage to the tissues, damage to the teeth. So what I have on here is to prevent decay, but it could also be to prevent damage to your tissues as well, because it's rocking, right? It's moving, and that's not good. So I have prevent decay. Loose bands and brackets will trap plaque right next to the teeth. If not seen to, demineralization will occur, leading to decay. Okay. So I don't know if you guys have seen decalcification. Yeah, it's pretty ugly. Okay, so what is the purpose of headgear?
Correct class 2 includes. I said class 3.
Yeah, so the answer that I'm looking for is like, it's just a general, super simple, all you really need to know. So control growth and tooth movement. That's all you really need to know at this point about headgear, okay? So don't worry too much about like the different types and what they're for. And they do correct class 2 and class 3, that is correct. But the answer that I'm looking for is to control growth and tooth movement, okay? All you really need to know. All right. And what are 3 categories of removable appliances? Exactly, passive, active, functional. So I've got just like some little notes beside them. So I've got passive. I don't know if you want to write this down with your brief description, but passive prevents rather than initiates movement. Okay, so it's preventing movement rather than initiating it. And then active, ready for active?
Mm-hmm.
It's used to move teeth in various directions. Okay, so active, used to move teeth in various directions. And then for functional, interacts with orofacial musculature. Okay. Interacts with orofacial musculature and allows for dental and skeletal growth during growth and development stages, if you have root problems. So interacts with orofacial musculature. Okay. So basically what you need to know is it's like muscle related. Functional is muscle related, okay? And it allows for skeletal and dental growth during growth and development stages. So that's why functional appliances can't be used for adults, okay? They're no longer growing, it doesn't make any sense. Ready to move on from that one? We're good? Good. I just want you to have these notes so you can study, you know. Okay, and number 5, what do we have for RME?
Active.
Active. Okay, so RME, active appliance.
That was an answer the whole time.
Exactly. Yeah, there you go. Not meaning cross marks on your face. Okay, how about a poly retainer?
Passive.
Passive, exactly. So passive. And how about a quad helix? Active, exactly, active. Okay, bionator? Functional, yeah, there we go. And Invisalign? Active, yeah. And twin block? Functional. And Essex? Passive.
No.
And you guys have your ortho handout, so I'm gonna say that's due next class, which is Monday, April 29th, okay?
What's my dad's birthday?
It's due, so just work on it and bring it in, and I might ask for you to hand it in, or maybe we'll mark it together.
Stop it. I'm not gonna do this.
Yeah, to go through it, it's really, really important information.
I honestly thought
Okay?
about it.
Important information about braces. And I think it's at lunchtime now? Thanks, you guys. Yeah, exactly. And then feel free to check
out the appliances.
This is mine.
Right.
Okay.
Oh, that's just.